Please, permit me to call on the podium to deliver the keynote of this year's event. Our own Professor Chema Ologa. In rounding up, we can do better than this. We can do better than this. It will give us this topic. This is the time to get it right in the health sector. Indeed, this is the time. Prof.
So, I just want us to focus it, especially on Enugu, because quite a lot of times we take back things, we speak about things that are out there, and when we do, it becomes kind of, in some way, it becomes a reason not to focus on what is before us. I don't know how many of us are comfortable, that are very comfortable. I'm sure the number of people that reach us for help and support, the number has increased. Those that call you, those that call us for needs, people are in need. And I think that when people wake up and say that, you know, they are, even if they report in surveys that they're accessing healthcare, it's simply because they are going to all kinds of places now for healthcare. It's a reality. Because the laptop is down there, you know, I have to move the slides. A few years ago, I mean, so many of us were involved in trying to form a wall of defense for everybody, including the political actors, even those that had money. They were all waiting, they waited to hear when, you know, COVID, we had finished dealing with COVID. I thank God intervened, because it's not because of all the things that we put in place, and then we recovered and moved on. But, you know, great appreciation to all the health workers, everybody here, and those that also lost their lives. It means, like the Honorable Commissioner was telling something yesterday, you know, our definition of life and health is different from how people define their own and satisfaction. There's just something about us that is strange, very strange. This thing should just be unpacked. Like after this, you now go and start asking the people, how do you actually, what do you mean by health? What do you understand? And satisfaction. Japanese are here with best life expectancy in the world. They are here. Our life expectancy is what? Is the second worst in the world, globally. Second worst. Second worst in the world. Everything is like second worst, out of pocket expenditure, maternal mortality. Second worst, everything. And then we're the most satisfied with life. Something is wrong somewhere. Now, next slide. So, it doesn't mean that we haven't done things. There are lots of things that have happened. There's quite a lot of progress. And I say particularly, I want to speak about us, and especially Enugu, because at the end of the day, we are here, people reach us. And I don't think that somebody wants to finish being a physician here and your immediate location, you know, there's no real contribution. There's a law, at the same Ministry of Health, thankfully we have some continuity. The Honorable Commissioner, the last 4 years, is still continuing and he's here with us. Let's put our hands together. And there are many aspects of that. It's quite important, especially because of, you know, sustaining policies. The MPAs have been established and strengthened over the last few years. There are federal hospitals here. It's not a joke that we have so many, that we have quite a number, and including the specialized ones. And there's something around the emergency, there's something existing in that direction for ESMAT. Private sector, there's a rich supply of it in this state. There's a USC agency. Dr. Ubu is there that led Primary Health Care Board as well. There have been facility improvements There are training institutions here. There's actually a lot in Enugu, you know, and then research, and I'll add to that one. We have some of the enviable research groups in this Enugu. Health Policy Research Group is world class. It's envied by people. I'm not saying it because I've been a part of it, but it's envied globally, right? It's a global institution. CTA is there. Somehow I'm also part of it. I'm the assistant director of that one. The Center for Translation and Implementation Research. It's a global brand. It's, you know, people are looking for how to drag it from Enugu. That's the truth. It's a leading implementation science outfit here. It's in Enugu. Now, I mean, we don't have a lot of development partners again. And then, of course, NMA has been making a lot of progressive strides. This is one of those places where it's been sustained. Next slide. In terms of health indices, there are very positive things as well, especially the base level. Health insurance, not that one. I mean, we really need to go up. This is not what it should be, but it has started. But things like the neonatal mortality rate is actually less than the target for SDGs. For Enugu is ahead. Infant mortality rate, the same thing, really. Vaccination coverage is near perfect, except you find people who are pouring things away. I've got some myself, but that was years back here in Enugu, and I reported it to the Commissioner of Health then. I caught people in Udi. You're not from Udi, nobody here is from Udi. Everybody is from Udi. I caught them, the back of the health facility, pouring polio, cutting vitamin A and pouring it. I knew it was oil based, so that's how I picked up. Then I saw red things. And then the polio ones, they were opening and pouring into a bucket. Like, when I now realized that it takes about $25 for one person, I was angry. If you don't cost it for vaccination things, you know how terrible it is for somebody that had no contribution to it, because he wants to get some money to chat. He carries it and pours away. If you know the cost that somebody denied his children and his family money and gave to Nigeria. You know, Nigeria, more than half of the cost of vaccines, these vaccines that are here for our children, we're not the ones bringing the money. We're not contributing up to half of the cost of the vaccines. We can't. If we do, our economy will crash. For vaccines, ANC is where it is. At least one is 95%. It needs to be 100, of course. And still attendance at delivery is quite high. It does not mean that this is happening in government settings. There are so many private settings. These are from surveys. So the other part is to know from the data from facilities, where are people actually coming? That's the time that you can actually tell the complete story. Are people using this, getting this access in public facilities? Next slide. Of course, it's not the end. There have been different reforms in this state. For drugs, district health system, effort, activity happened, the law reform, and many others. But of course, we still have a lot of challenges that are still hanging there. Politicians in the UK shout about NHS because everybody uses the NHS. That's why they talk about it. You only change the things that seem important to you. We can't change it. We don't use it. Next slide. We believe, next slide. in our subconscious, we are designing primary health care because of these people. Am I correct? So how are we going to create it, or fund it, or argue for it sustainably without looking for what goes into our pockets? We can't. Next slide. It is not for, next slide. Please go with me. It's not for this. This is Enugu as well. I mean, this is a healthy city. We are not designing it for these people until we think about those living in these places as people that we're designing primary health care for. Whatever we call it, we can't change it. We're not going to change it. But more importantly, next slide. Next slide. We need something that is about a service, and I'm careful to not to call it PSC. I think we need to think even a bit broadly. And I always ask, do we think that a woman having access to CS, if delivery is failing,